Hi, I'm Dr. Rob Cushman, your Acting Medical Officer of Health for the Renfrew County and District Health Unit. Today is April 1st, and I just wanted to give you an important update on where we stand with respect to the COVID-19 pandemic. You may have heard, but there's a new variant out there, a variation of Omicron, and it's more than half the cases in the United States presently, and is, if not already, will soon be half the cases in Ontario. It's hard to say whether it spreads more readily, whether it's more serious. We don't know, but I think it's a good time to make a few points. First of all, we came out of the first variation of Omicron quite slowly, probably about 10 days ago. And even today, as I look at our numbers, we have 18 people in hospital. We have 2 children at CHEO, and we have some other people in the ICU. So, and we have 8 outbreaks. And as you know, the testing, actually 1 in 8 people are now testing positive, but as you know, we're not testing enough people. So we figure for every 1 we find, there's probably 10 or 15 out there with the disease. Now, if you've been well vaccinated, sometimes this is disease like a cold. But on the other hand, we need to take this seriously. So we got through March. I think we were a little carefree, frankly, in terms of the vaccination passports and the lifting of masks. And it looks like we're going to pay for it. The question is how badly we're going to pay for it. Hopefully not, it won't be too bad. So I do have some messages for you. I think we need to get through April, at least the first half of April, beyond Easter, and we need to reassess. As you know, spring can drag on, or winter can drag on, and we don't have much of a spring. So it's very important that we get through March and we get through April. So I have some advice for you, and hopefully you'll heed it. We don't have these standard vaccine mandates anymore or obligatory masking, but I would ask you to take a few things into consideration. First of all, we're going to be at this for months and years. So please get the next vaccine that's available for you. If you haven't been vaccinated, seriously consider getting vaccinated. And there are now new vaccines that are available if you do have a problem, didn't want to even think about getting the mRNA vaccine. There are new vaccines which should come on site more readily in the next few weeks and months. So think about that. And if you've had a vaccine, get the next one you're eligible for. Maybe number 2. For most people in Renfrew County, it's number 3. Less than 50% of us have had a 3rd vaccine. So it's very important to get number 3. And even for people over 65, I think we'll be hearing shortly about a 4th vaccine that's available. Now listen, if you told me now that we need 3-4 vaccines within 18 months, it is disappointing. These vaccines aren't magic bullets, but this is what we have to do. And people who've had 2 and 3 vaccines, if they do get the disease, it's much more mild. And even though we've had 2/3 of our deaths, people over 60 and most of them over 80, since Omicron came in early December, it could have been much, much worse if we hadn't had protection from vaccines, because we've noticed that most of those people weren't fully vaccinated. And when you really look at it, about 80% of those people had actually had a 3rd vaccine. So vaccines work, and they're our best protection, and we need to continue thinking about them. If you've had the disease, if you've had COVID, you can wait 90 days until you get another booster. So vaccines, vaccines, vaccines. We're in this for the long haul. In the immediate future, the month of April, I would suggest masking in public places when you're out shopping. Certainly if you're at the barber shop, for example, or at a beauty salon, very important to mask. The kids have been able to mask. They have no problem with it. And if you're not masking, please be tolerant of those who are. It's certainly our right, and it can protect us. Equally, think a lot about how big a group you're going to be in. Keep your social settings small for the next month at least, until we really get into outdoor activities. And finally, and most important of all, if you do have any symptoms, please don't go to work or to school. This is really important. What we see now is that people are bringing COVID into hospitals, into long-term care homes, into retirement homes, into schools, and into businesses. And we all talk about keeping the economy going. Well, it's one thing to have a restaurant that's fully open, but if you're half-staffed, same in a long-term care home, same in a business, same in a hospital, you can't provide the services you need. So this is very important. So be careful. And as I said, I think we've got another month of this. We can see if we can successfully ride out this second variant of Omicron and bring on the good weather. And hopefully we'll have all this in the rear view mirror. So thank you very much.